When I founded my practice, specializing in chronic fatigue syndrome and fibromyalgia, we didn't have a lot of resources. So what we could offer was comprehensive, compassionate care and to take the time needed to listen to patients and see what we could do to help them. You know, I felt like that was a wonderful way to fill the gap, but it's very time-consuming, and but I learned so much from patients. On the other hand, last year when I was diagnosed with breast cancer, I went to the Huntsman Cancer Center. It's an amazing, well-funded building. Huge efforts are made to welcome patients and reduce their stress. I saw numerous specialists, very well-trained nurses and technicians, and everyone made huge efforts to make sure that I felt that I had enough information, that my family was included, that I could deal with my stress and make it through that difficult process. And my care was guided by biomarkers, by lab tests, by genetic studies, and other kinds of evidence-based medicine that determined what would give me the best treatment and the best prognosis. As I went through that, all I could think about was how few resources we have for patients with ME/CFS and fibromyalgia, and came back determined to do more than spending time with patients. And that's part of this evolution to the Bateman Horne Center. We need resources in order to be able to accomplish that. The most important needs right now are for us to move to a bigger space so that we can bring in new staff and also have a space that will be comfortable and beautiful for patients to come to. We not only need the space, but we need the space in order to bring in other medical professionals who can offer that kind of extended care and come in and learn from patients. The issue about this kind of expansion is it's expensive. We need help from the community and from other sources to be able to bridge the gap to coming into a new space and footing the bill for training new providers. So I'm asking for your help. I am deeply committed to our vision of mainstreaming ME/CFS and fibromyalgia into medicine and science. And we are deeply committed at Bateman Horne Center to the path and identification of biomarkers. I am going to wear my wild socks every day until we get those first tangible biomarkers. But we need others who are willing to invest in this. If you can become a monthly donor, that will be something that builds the kind of finances we need to make these changes and give us that security. A monthly gift of any size is valuable. It's ongoing and sustaining for what we need to do. If you want us to accomplish this dream, you've got to help us and join us. Thank you.